the vision and the purpose of the Ombudsman Group is what?
Yeah, so we're a federally mandated program via the Older Americans Act, and our job is to protect the resident. We work for them. So our goal is to address issues related to quality of life and quality of care. So if someone in a long-term care facility, so that includes skilled nursing facilities, what you might call assisted living, or we sometimes call it a sixth bed, which is like an assisted living in a house. So our job is to make unannounced facility visits to receive complaints from residents or their family members or their friends, as well as mandated reporters, and respond to those and find solutions. So if there's a concern about not getting the right food or not getting the right treatment or therapy, our ombudsman go to the facility and help to resolve that issue. And our services are free of charge. And as you said, we have a big poster in the facility, but sometimes people don't realize that there's people behind the poster.
So what does an ombudsman do? Are they paid?
So sometimes. So ombudsmen were intended to be community-based programming. So there are indeed volunteer, what we call field ombudsmen. They have undergone an extensive training program. They receive ongoing education on a monthly basis. But there are staff ombudsmen because it takes, a structure to really run their organization. So in our area, we have paid long-term care ombudsmen who are responsible for specific regions. And they have, in one case, I have a staff member who's been with me for 16 years.
Wow.
And in others, we have folks entering the industry. Right now, a long-term care ombudsman are prohibited from entering facilities. And we're planning our return to that here in California. But volunteers won't be in facilities for the near future just because we want to be cautious, of course, about COVID.
Exactly.
I have some volunteers who've been doing this for many years. They're quite dedicated. They are often folks who are retired social workers, attorneys, investigators who really want to have a meaningful retirement, as well as emerging professionals who are interested in working with older adults. But then we do have a very committed staff as well.
Well, I'm happy to hear that. If any of you are out there and after we either come out of the pandemic or just to explore, I know I have some friends that are newly retired. As you retire, think about becoming an ombudsman. And Nicole Howell, because of the 3 counties that she covers, she would be the individual that you would be learning from and being a part of a team that is vital to ensuring that facilities, we're not policing them. I remember, Nicole, when I first met you, you said, I did not take this job to police facilities. I took this job to partner and serve with them. Is that still your philosophy?
Yeah, certainly I like to think of it as collaborators.
Mm-hmm.
Sometimes as collaborators, you call the other person out and you're like, hey, you're not really doing your best work here. So certainly sometimes we are assertive and we have a harder line because we work for the resident. We want what they want. But generally we find that if you know a facility, if you work collaboratively with them, they want to do the right thing. They entered this field because they care about older adults and they just need help finding a solution.
So how are our facilities doing? I know that ombudsmen cannot go into the facilities at this time, but I know there's a reporting mechanism to the ombudsman group so that you know still what's going on in facilities. How are we doing in California?
Yeah, and I should say, just because we're not in facilities doesn't mean we're not resolving issues. My staff are on Zoom and FaceTime and Google Hangouts all day long, working with residents to resolve issues via care conferences or meeting with families or talking to facilities. So while we can't be in the facility, we're still very much resolving issues.
Excellent.
In terms of how we're doing in California, we have been quite touched, as you said at the start of the show, wear your mask, by this insidious disease, and it has sort of taken a weakness in the system of folks who are maybe a little more frail.
Yeah.
And we have a lot of staff going in and out. And so we do have active infections across California and in the 3 counties that I cover.
Wow.
What I will say is, unlike the early days of the infection, section where we were having problems getting PPE and we were just all trying to adjust so rapidly.
Mm-hmm.
Facilities have been able to secure the supplies that they need, but they have been in sort of shelter at home or safer at home for more than 90 days, and that takes a significant toll on residents and staff. Yeah. And so I think that we are